So, halitosis or bad breath. Basically, it's an unpleasant odor emanating from the oral cavity. Anything that emanates is usually not good. Most of the reasons for bad breath are pretty obvious: poor hygiene, gum disease, periodontitis, gingivitis, those sorts of things. That's basically like 80% of the causes of bad breath. The rest can be from sources not even in the mouth. GI issues, sinus disease, things like that. Medications like bisphosphonate medications, they can also cause halitosis, bad breath. But what if you brush your teeth and floss, but you still have bad breath? Are you missing something? Well, the dorsal surface of the tongue has an irregular surface area, basically, and it's perfect for the accumulation of bacteria, but food debris and so forth. Not just any bacteria, but anaerobic bacteria, the kind that do not need oxygen to live. So basically, the tongue fur needs to go. The white appearance of people's tongues, that's pretty normal. It's usually from residue, white blood cells, microorganisms like bacteria or even fungus. Lots of times the color changes are from, flavorings, things you pick up, eat and drink, and so forth. They actually have a name for the smell. Volatile sulfur compounds, or VSCs, are from bacteria coating your tongue. These are the major component in bad breath. And they can actually measure this objectively. How many of you actually clean your tongues with your brushing routine? Specifically like the back part, the middle back part of your tongue. That's usually where most of the bacteria hang out. So there have been studies on this. They do measure the VSCs, and they found that simply just basically using a toothbrush, even after you brush your teeth, just use that toothbrush, get it way back there and scrape it forward. That statistically does help with bad breath. A little bit better, though, is using a tongue scraper, kind of going from the back to the front. Same thing, getting that debris off. Bonus, it actually helps you taste things better, too. Clears up those taste buds, which is nice. And you're not really removing the bacteria so much as you're removing what the bacteria putrefies. So think about that, I guess. And lastly, is morning breath the same issue? People ask me that too, and not usually. At night, you typically produce less saliva, except for all you that drool on your pillows. But basically, bad breath will correct with normal brushing in the morning. So it is a little bit different than what we're talking about.